Have you ever felt that strange thing where a headache just seems to, I don't know, melt away the second you swallow a pill? Like way before it could actually be doing anything.
No, absolutely. That immediate sense of relief. It's uncanny, isn't it?
Yeah. Or maybe you've noticed feeling calmer, sort of more relaxed just by walking into the doctor's office, even before you've seen anyone or gotten any news.
Mm-hmm. That anticipatory calm, it's a really common experience. And it hints at something pretty profound about how we're wired.
It feels like your body's getting a head start, right? Anticipating the help.
Exactly. That anticipatory response, that incredible link between what we expect and how our body reacts. Well, that's what we're diving deep into today.
We are talking about the placebo effect, which for, ages was kind of brushed off, wasn't it? Like, oh, it's all in your head.
Right. Dismissed as imagination or just noise in the data for drug trials, a statistical annoyance, basically.
But maybe all in your head isn't a dismissal. Maybe it actually points to something incredibly powerful, something, real and measurable.
That's precisely the shift in thinking. Our mission today is to go way beyond those, frankly, simplistic explanations. We're going to unpack how the brain, when it's convinced healing is happening, can literally unlock its own internal pharmacy, its own medicine cabinet, if you like.
Okay, I like that. Inner pharmacy.
Yeah. We'll explore the psychological triggers, what sets it off, and then the actual neurobiology, the pathways in the brain, the chemicals, how an inert substance, a sugar pill, or even a fake procedure can cause real, measurable changes in the body.
So we're talking genuine physiological shifts.
Genuine, measurable physiological changes. By the end of this, you'll hopefully see that the mind-body connection isn't just some vague concept. It's a dynamic, constantly interacting loop.
What you believe, what you expect, it actually matters. Physically.
It matters hugely. Prepare to discover how your own beliefs can sometimes rival, maybe even beat, the effects of actual drugs. It really does put the mind-body link in a whole new light.
Okay, let's get into it then. Because like we said, for so long, placebo was almost this awkward thing in medicine. Like, yeah, it happens, but let's focus on the real drugs.
Right. It complicated things. It made it harder to prove a new drug actually worked because you always had this baseline effect from the placebo group.
But you're saying it's so much more than just imagination or, people being easily fooled.
Absolutely. That's the first big hurdle to get over that old dismissive view. We're not talking about someone just wishing themselves better.
Okay.
The scientific consensus now is really clear. The placebo effect is a genuine, what we call a psychobiological phenomenon.
Psychobiological, so mind and body interacting.
Exactly. A mental state shaped by what you expect, what you believe, even what you've learned in the past directly triggers a cascade of real biological events, physical stuff happening inside you.
Wow, so the brain isn't just passively sitting there, it's actively involved in healing.
It's an active participant. And that brings us to the core driver. You mentioned expectation and belief. Is that really the most powerful part?
That seems to be the key, yeah.
It really is. Probably the single most potent factor we've identified is a person's strong belief, their expectation, that a treatment is going to work.
Just believing it's going to help.
Yeah. When you anticipate that positive outcome, like, this pill will stop my pain,
Yeah.
your brain doesn't just wait around. It actually starts to prepare for that reality.
How does it prepare?
It kicks off internal processes, physiological changes designed to align your body with what you expect to happen. It's a very powerful top-down process. Your thoughts, your beliefs are driving the biology.
But hang on, where do these strong expectations come from? You don't just magically believe a sugar pill works, do you? There must be cues.
Yeah.
Things that build that belief.
Oh, absolutely. It's not formed in a vacuum. It's heavily shaped by the entire context, the whole medical environment, the rituals involved.
Like what specifically?
Well, think about the clinician, the doctor or nurse, their perceived authority, how much you trust them, how empathetic they seem.
Right. If they seem confident and caring.
Exactly. If they project expertise and compassion, that can massively boost your expectation of success. Their confidence becomes, in a way, contagious to your brain.
So if a doctor looks you in the eye and says, really confidently, this is going to help you, that alone starts the process.
Wow.
Even before the treatment.
It absolutely can. That therapeutic relationship, that trust and rapport, it's incredibly powerful. It's a key ingredient in the placebo effect itself.
Okay, so the doctor matters. What else?
Well, there's also the perception of the treatment itself. How sophisticated does it seem? How expensive?
Wait, expensive. Does that make a difference?
It sounds strange, doesn't it? But studies show that, yes, treatments perceived as more expensive or more high-tech, even if they're actually placebos, often generate a stronger effect.
Why would that be?
There's probably a subconscious heuristic at play, if it costs more or looks fancier, it must be better. It taps into our associations about value and efficacy.
So a sugar pill you think costs $100 might work better than one you think costs 10 cents? That's wild.
It is pretty wild, but the evidence supports it. Our brains make these connections, and it's not just cost. Think about sensory cues.
Like,
The color of a pill, the shape, the branding.
really, color matters.
It can, yeah. Research suggests, for example, blue pills are often associated with sedation, maybe sleep aids. Red or yellow pills might be linked more to stimulants or pain relief.
Wow.
And a branded capsule might feel more professional or effective than a plain white tablet. These aren't neutral details for our perception. They all feed into the overall expectation.
It's like our brain is constantly scanning for clues about how effective something might be.
Precisely. And then there's the whole ritual of medicine, the entire process.
You mean like making the appointment, going there?
Exactly. Making the appointment, sitting in the waiting room, the examination by the doctor, the act of getting an injection, or even just the routine of taking a pill at a certain time with water. These aren't just logistical steps, they're powerful symbols. They reinforce the idea that something significant is being done for you, that healing is happening. The whole ritual enhances those positive expectations.
It's the whole performance almost, not just the pill itself.
It really is, and we see this reflected in studies. For instance, have you heard that 2 placebo pills often work better than 1?
Seriously, even though they're both sugar.
Yep. The brain seems to interpret 2 as a stronger dose, a more serious intervention, so the expectation goes up, and so does the effect. And similarly, a placebo injection is often more powerful than a placebo pill.
Why is that? Because it feels more medical, more invasive.
Exactly. Injections are generally perceived as more potent, more direct. They bypass digestion, they feel more significant, so the expectation is higher, and the placebo response follows suit.
So the brain is making these really sophisticated guesses about potency based on all these external cues. It's amazing.
It really is.
Yeah.
That top-down cognitive process we talked about, using context to kickstart the body's own response, that's expectation. But there's another layer too, isn't there? Something more automatic.
You mean conditioning?
Exactly. Classical conditioning, like Pavlov and his dogs.
Right, the bell and the salivating dogs.
Yeah.
How does that fit in with placebos?
Well, think about it. Throughout our lives, we have countless experiences where we associate the act of taking medicine with feeling better.
Yeah, you take a cough syrup, the cough eases. You take a painkiller, the pain goes.
Precisely. From childhood onwards, there's this repeated pairing. Medical ritual leads to symptom relief. Our bodies learn this association, often unconsciously.
So the things associated with medicine, the taste, the look of the pill, the doctor's office smell,
Yeah.
they become like Pavlov's bell.
That's a perfect analogy. Those initially neutral stimuli, swallowing a pill, the sight of a syringe, even the specific way a medicine tastes or smells become conditioned stimuli. They become so strongly linked in our brains with the actual effect of past medicines that they can eventually trigger a similar physiological response on their own.
Even without the active ingredient.
Even without it, the body has learned. This ritual means relief is coming. So it preemptively starts activating those relief pathways, those healing mechanisms. It's an automatic, learned response.
That's fascinating because it suggests it's not always about conscious belief in that moment. It could be a much deeper ingrained biological habit.
It absolutely can be. This conditioning helps explain why sometimes the mere ritual of taking something, anything, can provide some relief. The body is drawing on its library of past experiences.
So expectation sets the stage consciously, but conditioning works almost automatically in the background.
That's a good way to put it. Both are powerful psychological drivers leading to real biological effects. Which brings us to the really exciting part. The neurobiology. What's actually happening inside the brain?
Right. This is where it moves from psychology to, well, hard science. You mentioned neuroimaging.
Yes, this is where things got really concrete. Before modern brain scanning techniques like fMRI and PET scans, it was hard to prove anything physical was happening. It was mostly subjective reports. I feel better.
Okay.
But fMRI lets us see changes in blood flow, indicating brain activity, and PET scans can track neurotransmitters. With these tools, We can literally watch the brain respond to a placebo in real time.
You can see the brain changing.
We can see physical, measurable changes in brain function. It's not just imagination. And the crucial takeaway, the really big point here, is that the brain isn't just perceiving relief, it's actively producing it
Oh.
by releasing its own chemicals, that inner pharmacy we talked about,
Yeah.
endogenous substances that have real effects.
Which leads us to pain relief placebo analgesia. This is the most studied area.
By far. It's the clearest example we have of the placebo effect's power and the mechanisms behind it. When someone truly believes they're getting a strong painkiller,
Their brain initiates a genuine pain-relieving effect. And often, it's not trivial. It can be quite significant, sometimes approaching the level of actual opioid drugs.
so what parts of the brain light up? What's the pathway?
It's a really interesting cascade. Neuroimaging shows activity starting often in the prefrontal cortex.
The brain's control center, where we make decisions and form beliefs.
Exactly. That's where the expectation seems to originate. Then, signals travel down through areas like the anterior cingulate cortex.
And what does that part do?
It's heavily involved in the emotional experience of pain, the unpleasantness, the suffering aspect, not just the raw sensation.
Okay, so targets the ouch, this feels bad part.
Sort of, yes. And the pathway often culminates in a region in the brainstem called the periaqueductal gray, or PEG.
PEG, what's its role?
The PEG is a major hub for controlling pain signals traveling up the spinal cord. It can basically turn down the volume on pain messages before they even reach the higher conscious parts of the brain.
Like a gatekeeper for pain signals. A very effective one. And here's the kicker. What does this whole cascade trigger the release of?
Let me guess. The brain's own painkillers.
Precisely. Endogenous opioids, things like endorphins and enkephalins, the body's natural morphine.
Wow. And these use the same pathways as drugs like morphine.
The very same pathways. The brain is literally activating its own opioid system in response to the belief it's getting pain relief.
That's incredible. The inner pharmacy is real. But how do we know for sure it's the opioids doing the work? Is there definitive proof?
Yes. The definitive proof is really elegant, actually. Scientists use a drug called naloxone.
Naloxone, isn't that used to reverse opioid overdoses?
Exactly, because it's an opioid antagonist. It blocks opioid receptors in the brain, preventing opioids, whether they're drugs or the body's own endorphins, from binding and having an effect.
Okay, so what happens if you give naloxone to someone experiencing placebo pain relief?
The placebo effect vanishes, or it's significantly reduced.
Get out.
Really, if you block the opioid receptors, the pain relief triggered by the placebo goes away. That's about as close to conclusive proof as you can get in biology. It shows the pain relief is a real opioid-mediated biological event.
That is stunning proof. It's not just a feeling, it's biochemistry that you can switch off.
Yeah.
But does that mean all placebo pain relief is opioids? Or are there other chemicals involved too? Could some placebo effects survive naloxone?
That's a great question. And the answer is it's likely more complex. While opioids are clearly a major player, especially for strong pain relief expectations, other systems might be involved too.
Like what?
Well, some research points towards the brain's own cannabinoid system, similar to the compounds in cannabis playing a role in certain types of placebo responses. And dopamine might also be involved, particularly in how we anticipate and feel rewarded by potential relief.
So the brain has multiple tools in its kit.
It seems so. Depending on the context, the type of symptom, and the specific expectation, the brain might deploy different neurochemicals. Opioids are key for pain, but it's probably not the only story. The inner pharmacy is well stocked.
Fascinating. Okay, so pain is one big area, but you mentioned it goes beyond that. Parkinson's disease. That seems like a huge leap from pain to a neurodegenerative movement disorder.
It is a leap, and that's why it's such compelling evidence for the breadth of the placebo effect. Parkinson's, as you know, involves the loss of dopamine-producing neurons.
Right, leading to tremors, stiffness, slow movement, fundamentally physical symptoms.
Exactly. And yet, studies consistently show that placebos can lead to objective, measurable improvements in motor function for these patients.
Objective. So not just the patient saying they feel better.
No, these are improvements that neurologists can measure using standardized clinical scales. They see reduced tremor, faster movement, better coordination. It's tangible.
Just from a sugar pill or a sham treatment, they believe is helping their dopamine levels.
Yes. And we have PET scans showing why. When a Parkinson's patient expects to receive a beneficial drug, their brain actually releases a surge of dopamine in the striatum.
The striatum. That's the brain area crucial for motor control, right? The one that's starved of dopamine in Parkinson's.
The very same. The expectation of treatment triggers the release of the exact neurotransmitter that's deficient in the disease. It's a temporary effect, of course, but it's a significant release.
That is absolutely mind-blowing. The brain, just through belief, can temporarily compensate for its own neurochemical deficit.
It seems it can, to some extent. It's a remarkable demonstration of top-down control, the cognitive state, the belief, directly influencing neurotransmitter release in a way that impacts physical movement.
It really highlights the brain's active role, doesn't it? Not just processing information, but actively modulating its own chemistry.
Precisely. And this extends to mood as well. Think about depression.
Ah, yes. Another area where the mind state is obviously crucial. How powerful is the placebo effect there?
It's remarkably powerful. In clinical trials for antidepressants, the placebo effect is often substantial, sometimes even approaching the effect size of the active drug itself.
Does that mean antidepressants don't work?
No, not at all. Antidepressants clearly help many, many people, but it does highlight how significant the psychological components are in treating depression.
Like what? Hope, expectation.
Exactly. Hope, positive expectation, feeling cared for, the therapeutic relationship with the clinician. These factors have a huge impact on mood disorders.
The therapeutic alliance again.
Absolutely. It's critical. And again, neuroimaging shows changes in brain activity in depressed patients responding to placebos. We see shifts in the prefrontal cortex and the limbic system areas involved in regulating emotion, self-awareness, and cognitive control.
So it's not just feeling better subjectively. The brain's emotional circuitry is actually changing.
That's what the evidence suggests. The belief in getting help seems to allow the brain to recalibrate some of those circuits involved in mood regulation.
Okay, so the placebo effect is this incredibly powerful force for potential healing, driven by belief, context, conditioning, and resulting in real neurochemical changes.
Wow.
But is there a downside? A dark side to this power?
There absolutely is, and understanding it is just as important. It's often called the dark twin of the placebo effect.
No.
The nocebo effect.
Nocebo. So no instead of plaw, harm instead of benefit.
Exactly. The same powerful mechanisms, expectation, belief, context, conditioning can work in reverse. Negative expectations can lead to real negative physiological outcomes.
So if I expect something bad to happen from a treatment, it's more likely to actually happen, even if the treatment is inert.
That's the essence of the nocebo effect. Negative expectations, fueled by things like fear, anxiety, warnings about side effects, or even past negative experiences, can manifest as real physical symptoms or make existing ones worse.
Can you give some examples? How does this play out?
Well, a classic example comes from clinical trials again. If you tell participants, even those getting a placebo, that a potential side effect of the drug is, say, nausea, a significant number of people in the placebo group will actually report experiencing nausea. Their expectation makes it real for them.
Wow. Just being told it might happen is enough.
It often is. Another common one is reading that long list of potential side effects that comes with medications.
Oh, yeah. Those are scary sometimes.
Right. Just reading that list can sometimes induce some of those very symptoms in people purely through negative expectation. Your brain anticipates them and sometimes obligingly produces them.
I think I've felt that. You read may cause headache, and suddenly your temples start throbbing.
It's a very common reaction. And again, crucially, this isn't just people being suggestible or imagining things in the old dismissive sense. The nocebo effect has a real biological basis, just like the placebo.
So negative thoughts trigger negative biology. What's happening in the brain then?
When negative expectations take hold, brain imaging shows activation in areas linked to anxiety and threat detection. Think the hippocampus, involved in stress memory, and especially the amygdala.
The amygdala. The brain's fear center.
Pretty much, yeah, the brain's alarm bell. Activating these areas can trigger the release of stress hormones, like cortisol.
Which isn't great long-term.
No. And it can also activate pathways that actually increase pain sensitivity. Your brain becomes hyper alert to discomfort.
So you feel pain more acutely.
Yes. And this seems to be facilitated, at least in part, by neurotransmitters like cholecystokinin or CCK.
CCK, what does that do?
CCK is known to amplify pain signals and anxiety responses. So when you're expecting something bad, your brain might release CCK, essentially turning up the volume on pain and distress.
Wow. So the brain can dial pain down with opioids for placebo, but dial it up with things like CCK for nocebo.
It appears that way. It really underscores that the mind's influence is powerful but neutral. It can heal or it can harm, depending entirely on the beliefs and expectations driving it.
That has huge implications for how doctors talk to patients, doesn't it?
Immense implications. How potential side effects are framed, how information is delivered. It all matters. It's a delicate balance between informed consent and avoiding the accidental triggering of nocebo effects. Words have real biological power.
So understanding both sides, placebo and nocebo, is critical for actually using this knowledge effectively in medicine. Which brings us to, how do we use it?
Ethically, practically.
Right. It's a central question.
We know placebos are powerful, so how do they fit into modern medical practice and research?
Well, we use them in clinical trials, obviously. You mentioned that's the gold standard.
Exactly. The very existence of the placebo effect is why the randomized, double-blind, placebo-controlled trial is essential. We need that placebo group as a benchmark.
To see if the real drug does anything better than just belief and context.
Precisely. A new drug has to significantly outperform the placebo to be considered effective. It has to prove its worth above and beyond the body's innate response to the ritual of treatment. If it only matches the placebo, well, then the drug itself isn't adding much value pharmacologically.
Okay, so they're essential for research integrity. But what about actually using placebos as a treatment? Can a doctor just prescribe a sugar pill? That feels ethically tricky.
It is very ethically tricky, and traditionally the answer has been largely no, precisely because it involves deception.
Because you have to lie to the patient, basically. Tell them it's real medicine.
Right. And that violates core principles of medical ethics. Truthfulness, patient autonomy, informed consent. It risks damaging the trust between patient and doctor, which itself is therapeutically important. So for decades, it seemed like this powerful effect was mostly off limits for direct clinical use because of the deception required.
So we know the brain has this amazing ability, but we can't ethically trigger it on purpose. That seems like a waste.
It did seem like a paradox. But this is where some really fascinating cutting-edge research comes in, a whole new approach called open-label placebos.
Open label, meaning
Yeah.
you tell people it's a placebo.
Exactly. You are completely honest. Patients are told explicitly, this is a placebo pill. It contains no active medication, just an inert substance like sugar.
But wouldn't that completely destroy the effect? If the whole point is belief in the treatment and you tell them it's not a real treatment.
That's what everyone initially thought. It seems totally counterintuitive. But here's the truly remarkable part. It often still works.
Wait, what? How?
Well, it's not just, here's a sugar pill. Crucially, alongside the honest disclosure, patients are also educated about the placebo effect itself.
Ah, okay. So they're told this is inert, but we know the placebo effect is real. Your body can respond to the ritual. Your mind has power, that kind of thing.
Precisely that. It shifts the focus. Instead of deceiving the patient, you're empowering them with knowledge about their own mind-body connection. You're framing the placebo not as a trick, but as a potential tool to help them activate their own internal healing mechanisms through the ritual of taking it.
So the belief object shifts from the pill's ingredients to the process and the body's potential.
That seems to be a key part of it. Belief in the ritual of care, belief in the body's capacity, understanding the science behind placebo effects, these seem to be enough in many cases to generate positive outcomes even without deception.
And this has actually been shown to work. For what kinds of conditions?
Yes, there's a growing body of evidence. Open-label placebos have shown significant positive results for conditions like irritable bowel syndrome, IBS.
Okay, that makes sense. IBS has a strong mind-gut connection.
It does. Also for chronic low back pain, which is notoriously difficult to treat, patients reported reduced pain and disability.
Wow. Chronic pain.
Yes. And even things like cancer-related fatigue, reducing that pervasive exhaustion that often accompanies cancer and its treatments. Also some studies on allergic rhinitis, ADHD symptoms, menopausal hot flashes. The range is broadening.
That's genuinely incredible. It suggests the power isn't just tied to believing in a specific chemical, but perhaps in the act of seeking and receiving care itself and trusting your body's ability to respond.
Exactly. It highlights the therapeutic power of the ritual, the patient-provider interaction, and maybe even just the structured attention given to the problem. It suggests that harnessing the placebo effect might be less about the substance and more about optimizing the entire context of care and empowering the patient's mindset.
This really does change the game, potentially. It opens a door to ethically leveraging this internal healing capacity.
It really does. It's a very exciting area of research.
So bringing all these threads together, this deep dive shows the placebo effect is far from trivial. It's not just noise.
Absolutely not. It's a fundamental demonstration of the mind-body connection. Hardwired, powerful, and scientifically observable.
Our brains aren't just passive receivers. They're actively shaping our physical reality based on belief, context, and learning. deploying that inner pharmacy.
That's the core message. Your brain has this incredible capacity for self-regulation and healing influenced by psychological factors.
And crucially, studying this isn't about promoting fake cures or ditching real medicine.
Not in the slightest. It's about understanding all the factors that contribute to healing, including our own internal resources. It's about figuring out how to ethically add this powerful dimension to existing evidence-based treatments, making them potentially even more effective.
So looking ahead, what's the future vision here? How might this understanding change medicine?
Well, the hope is for a future where things like the psychological context of care, managing patient expectations positively, building strong therapeutic alliances, these aren't just seen as nice-to-have soft skills.
Right. They become recognized as actual therapeutic tools.
Exactly. Measurable, impactful tools that can be consciously and ethically integrated into treatment plans alongside drugs and procedures. It's about creating a more holistic approach that leverages everything we know works, including the patient's own mind, to optimize outcomes, activating that potent medicine within.
A more patient-centered and perhaps even more effective approach overall.
That's the potential, yes.
That really is a powerful thought to end on. So for everyone listening, knowing all this, knowing your brain has this potential, this inner pharmacy, how might that change how you think about your own health?
How might you engage with treatments or interact with your doctors?
Yeah, or even just how you view the power of your own mindset, your beliefs in daily life. Are there other areas where you see this mind over matter potential playing out? Definitely something worth thinking about.